Right, welcome. I'd like to take a moment to thank the conference organizers for this beautiful event, informative, and it is an honor to speak with you today. Treatment-resistant uh, patients experience significant hopelessness and despair when they are unable to find next steps. And some of them, many, possess a determination to find solutions that can help them. Energy therapy provides a wonderful means of helping these patients, and I'm excited to speak with you today about an innovative way to deliver this healing, digital energy medicine, for this patient population. I'm Sarah Lascano. I'm the founder of Raisin Energy. I'm a master biofield therapist and an energy medicine practitioner. I specialize in helping people when nothing else is working. My patients typically come to me when they have tried many, many different healing modalities, both allopathic or Western and traditional, and they are still stuck. My work typically helps them, as we will talk about in a moment, by strengthening their energy from the ground up so that these therapies can work and they can find healing. Today, I'm going to briefly cover the principles of energy medicine. I'm going to define digital energy therapy, what it is, and discuss some opportunities for its use in clinical practice. Our body functions on biofields. We know this. We measure the biofields of the heart with EKGs, of the brain with EEGs. We measure the energy flowing through the nervous system with nerve conduction studies. We are aware of the energy flowing through the meridians of the body that acupuncture and acupressure and other traditional healing modalities use. Our emotions and our thoughts also have energy that affect the body. These energies can be manipulated for healing with energy therapies, a variety of different types. But the body stores energy that disrupts its function. Trauma, belief systems, dysfunctional families, adverse childhood events, periods of significant stress from infections, injuries, caregiving of others, dysfunctional situations at work, any type of unresolved stress that is too much for the system to cope with can become stored in the body. What this does is create significant energy blocks that then derail the body's natural healing ability. It's almost as if it has been disconnected or corrupted. Energy therapies can lift these off. There is tremendous research proving this mind to body and body to mind connection. And the fact that these energies get stored and then lead to chronic health issues later in life. But we can free this stored energy and we can heal the body by removing these disruptions. Energy therapy is proven in the medical literature. There is plenty of literature supporting its use, both in person and distance healing. Today, I'd like to introduce a new vehicle for use of energy therapy, digital. Now, energy therapy is the perfect complement to medical care of all kinds. It does not compete or interfere with any other therapies. It is not a replacement for medical care, although it can serve as healing on its own. But here I speak of digital therapy as a complement to other forms of care, whether it is medical, herbal, even energetic, any sort, or even therapy. Working with removing the mind-body blocks that exist in the system, in the body, leads to very quick results by, again, strengthening the body from its foundation up. Now, what exactly is digital energy medicine? Digital energy does affect the biology of organisms. There are experiments that show that a recording of an energy source exerted on a system has the same biological response as the live energy source. There are experiments that show this. Dr. Emoto's work, Lynn McTaggart expands upon a lot of the quantum physics behind this in the field. There are experiments that show that a recording, even over a telephone or played from a digital recording, exerts the same effect at the cellular level, even on the biological system. And that is the premise behind digital energy therapy. This is a recorded energy therapy session. These particular ones that I use in my practice are clinically focused. This is not generalized. This is very therapeutically and clinically focused. They address a specific theme, such as boosting the immune system, balancing the microbiome, helping process certain forms of emotion, anger, or negative self-talk, decreasing anxiety. There is an extensive library of these sessions. The patient listens to these audio sessions and they receive energy therapy as they are listening that address both the body, the mind, and the spirit, all parts of the body. The results are immediate and can be very clinically significant. I'd like to talk through some standard results that people see. In one instance, a child listening to these sessions before bed for less than a week resolved his night terrors. A tick-borne illness in a pet. This pet had severe neurological dysfunction from a tick-borne illness and was not responsive to antibiotic therapy. They were discussing euthanasia, and while they were waiting to see a tick-borne specialist, they listened to the immune repair session. In just 3 listens, the dog's behavior completely changed and he started recovering. They actually never needed to pursue the specialist, and the dog has since recovered. That is a profound example because a human with those symptoms would immediately be hospitalized and worked up. So it was a wonderful opportunity to see the potential of this therapy. People report improved energy levels, less fatigue, lower anxiety across the board. So in anxiety disorders, in health anxiety, when someone has received a troubling diagnosis, also when people are going through cancer treatment, and even in palliative care, this technology is amazing at reducing anxiety levels and improving quality of life. Improving sleep, patients use this technology before they go to sleep, or even during the night when they wake and cannot get back to sleep. They report sleeping longer, sleeping better, and not waking or being able to get back to sleep when they do wake easier. So improved sleep quality. Improved appetite during chemotherapy has been noted with this technology. A chemotherapy patient who was unable to eat and was actually not able to function because of fatigue after 30 minutes after listening was able to eat and do some functional, normal everyday function. So definitely improving quality of life in this patient population. Quicker recovery from common infections has been noted, the common cold, flu, COVID, as well as gastrointestinal upset. Patients report this, especially after listening to an infection-oriented session, and they feel that these are key in helping them recover quickly. Also, less food cravings has been noted. So patients who are trying to follow a prescribed dietary protocol have noted less cravings and better ability to adhere to their treatment plan. Now, this technology is also in use in an addiction recovery center in a group setting. So these patients are noticing improved resilience, decreased anxiety, and just feeling better about their possible outcome of being able to regain control of their lives. Again, this is an early recovery peer support group where this technology is being used. talk briefly about methods for clinical use. We just described the group setting where in an addiction recovery center, a group convenes and the session is played for the group in a group setting. Another method of being able to use this is as a self-help tool for patients. So if patients need or desire some tool to help them address symptomology, they can use this technology in between sessions or as an adjunct to empower their health. Just having the power to access something that helps people feel better, calms their nervous system, gets them into a parasympathetic mode is invaluable to them. And they really respond well to being able to have something to use. Even in the middle of the night, this technology is available 24/7. So it's a very handy resource for patients. And then as I use this in my own practice as a prescriptive tool for an adjunct to other therapies. So when a patient is not responding to treatment, when they're having trouble tolerating treatment, when there is an evidence of a very obvious mind-body connection to their illness, and I agree with the last presenter in terms of cancer, bowel disease, and certain diseases have a very strong mind-body connection. These tools are amazing. And they can be used to manage symptoms in between appointments with practitioners or as an adjunct, as a prescriptive. So the doctor could tell their patient to focus on these particular areas in between if they know that that is a common cause of their dysfunction. It is worth noting that these sessions can be customized to unique patient populations. So already there are sessions that have been created for the cancer population, as well as the addiction recovery population. Other sessions could be created, such as the pelvic pain community, accident and injury recovery, and other unique mind-body connection needs that could exist in unique populations. This is something that is not that difficult to do. The benefits of digital energy therapy are vast. First, there is no outside referral needed. This is a tool that a practitioner or healthcare provider can use in their practice without having to refer outside. This is a self-help resource that can empower patients and give them something to help them feel better when they need it. It is available 24/7, as we discussed. It is accessible from any electronic device. It does not require travel. It does not require talking to someone about stress or physical symptoms. There is not extensive training needed to learn how to prescribe and use these in a healing practice. There are no side effects or interactions. So if a practitioner prescribes therapies, even medication, anything, this does not interfere with that in any way. And probably the biggest potential and exciting benefit is that it's accessible. It's low cost, it's easy to access, and it could help populations that have not been able to access energy therapy be able to benefit from it. And this is especially true that we are seeing in the early addiction recovery community. These folks do not have the resources for one-on-one sessions or seeking out complementary or integrative care. So this is an exciting method for populations that may not have been able to access this type of healing to receive its benefits. To summarize, digital energy therapy delivers expert mind-body energy therapy as an adjunct to care at low cost, with no additional appointment time and without significant training on the part of healthcare providers. It's an innovative and effective way to address the mind and the body interplay as part of medical care, especially for diseases where this plays a big, large role. And at the bottom, at the end of the day, it really helps boost patient outcomes. Thank you.
Many thanks to Sarah Lascano, to United States. It's amazing to see the ancient Ayurvedic technique and proceed later into the modern research and data that can be all combined for the profit of the people. Thank you very much for that.